Let us talk about the next important topic, cardiac glycosides, Digitalis. They are mainly used in the management of CHF and also for arrhythmias, atrial fibrillation, atrial flutter, paroxysmal atrial tachycardias. Why are they used, doctor? If atrial fibrillation is there, no, nothing to worry. But that atrial fibrillation, if it goes into ventricle, then ventricle fibrillation means it's a visa to next planet. So, by giving a Digitalis, it has a vagomimetic activity, and that will lead to AV node going to refractory state and prevents atrial electrical activity passing into ventricle and controls the ventricular rate. So, that is the reason we give Digitalis for its vagomimetic AV blocking effect in the management of the atrial fibrillation. But lot of studies, after doing them, they found you give Digitalis or no Digitalis, patients are going to die same way. So their use is slowly has come down in the modern times. The most common agents that we use are basically Digoxin and Digitoxin. How do they act? I think you still remember our cardiac physiology, cardiac contraction, everything which we discussed, smooth muscle, skeletal muscle, everything. They inhibit one fellow called sodium potassium ATPase pump. What will this sodium potassium ATPase pump will do? It will bring the potassium inside, throw the sodium out. The throwing of the sodium out is also the driving force for throwing the calcium out. If the sodium potassium ATPase is blocked, sodium can't be thrown out, intracellular sodium increases, there is no motivation for calcium to leave out if the sodium didn't come. So intracellular calcium will increase, and whenever there is any nerve stimulation, what will happen? Too much calcium is released by the sarcoplasmic reticulum and inotropic strength of the heart will increase because more actin myosins will touch each other. So that is the underlying cause for the positive inotropic effect. So what are the important effects of giving Digitalis? There are two kinds. Directly it acts on the heart, direct effects, and indirectly by activating the vagus and parasympathetic system, it has indirect effects. So what are the cardiac effects? Digitalis will increase the systemic vascular resistance. It will contract the smooth muscle on the veins, and these are the two important effects in a normal guy who don't have congestive heart failure. In fact, in a normal guy who don't have congestive heart failure, if you give Digitalis, the cardiac output may in fact decrease rather than increasing. Now let us see, how is our guy who has a failing heart? A guy with a failing heart has no capacity to develop the force when there is a systole. Because of that, what will happen? At the time of the systole, blood don't leave the heart. It remains in the heart only. Once more, when the heart gets filled through the diastole, that blood is coming. Previous systole homework which is not done is already stagnant. Together will lead to end diastolic volume to increase. So increased end diastolic volume, what Frank Starling said, if there is a more homework, there is a more anxiety in the heart. If there is a more stretch of the heart due to increased end diastolic volume, there is a more contractility and more myocardial oxygen demand and work of the heart. So that is what will happen. So the heart rate, ventricular volume, pressures generated at the time of the ventricular contraction, all will get elevated. But stroke volume will not be elevated because it's a failed heart. Even if stretch is there, even if contraction is tried to be more still it is unable to pump sufficient stroke volume. If you give a cardiac glycoside to a failing heart, stroke volume will improve, it will increase the cardiac output, same time the venous pressure will come down, endostolic volume will come down when the inotropic state of the heart increases, and the congested heart becomes smaller, and the efficiency of contraction will increase, and there is an improvement in the circulation. So these are all the effects of the Digitalis. Then one important thing is, Digitalis has got a vagomimetic effect directly. What is the effect on the nervous system on the sympathetic output? Normally in a failing heart, how is his sympathetic output? A failed heart will pump less stroke volume. Decreased stroke volume will lead to decreased volume in the vessels that will be sensed by the baroreceptors that will tell the brain, and his sympathetic activity will increase. Already it is a failed heart. On the top of it, if you sit and say that work more, sir, entrance notification is there, sir, please let me study, sir, no injection duty, sir, you'll be crying. Professor will be saying, in our days we used to be like this. Then you will go behind and say, in your days copying was easy in entrance exam. In our days it is very difficult. So that's the reason you did injection duties, we can't do. So heart will further fail. So doctor, if you give Digitalis, this entire cycle reverses. Stroke volume increases, baroreceptor stimulation decreases, sympathetic outflow decreases, oxygen demand, myocardial oxygen demand decreases, failing heart is happy, less injection duty, more time to study in reading room, etc., etc. Now, how about renal blood flow? Digitalis also improve the renal blood flow. It will increase the sodium and water to be lost into urine, increase GFR, increase urine formation, decrease congestion of the body. Then what are the neural effects? It will increase the vagal activity. It will delay the conduction across the AV node, and it will decrease the sympathetic tone, etc., etc. So let us talk about Digoxin as a drug. Digoxin is drug only, but pharmacokinetics of it. It distributes everywhere, more into the heart. It allows to live in the heart. And if you take the concentration of it in the heart, it is typically twice more than skeletal muscle, 15 times more than what it lives in plasma. But you need to individualize the dosage of Digoxin, because one of your patient is fat, one has congestive heart failure, one has a renal failure. Some need loading dose, some need a different maintenance dose, but loading dose is definitely required, and you need to basically estimate it based on the given patient. So Digoxin, we said, we use for two reasons. One is to manage CHF, other is to manage atrial fibrillation, to rate control. In which case you require more dosage. For rate control, when you use Digoxin, you require more dose compared to when you use it for CHF. And if you give Digoxin, there is a variable absorption of the Digoxin. That is another important problem. Generally, how will you write Digoxin? 5/7. Not all 7 days. 5/7. Okay. Then the peak effect after you give an IV dose, it will be in 1.5 to 2 hours. And one of the favorite MCQs of examiner, Digoxin only orally given or intravenously or both the ways? Both the ways, you should remember. Then half-life is about 1.5 days. And what is the relation between loading dose and maintenance dose of the Digoxin? Another high yield fact, commonly asked by the examiner. 35% of the loading dose is equal to the maintenance dose. And Digoxin versus Digitoxin, if you take, the Digoxin's effects appear, both therapeutic effects and the disappearance of toxic effects, they occur more rapidly compared to that of the digitoxin. That's the reason we prefer digoxin, because therapeutic effects appear rapidly and toxic effects disappear also rapidly for digoxin compared to digitoxin. Now, how is digoxin eliminated? Not by the liver, by the renal route, unlike digitoxin. So that is the reason any patient whose creatinine clearance is altered with renal failure, you need to alter the digitalis dosage, because the T half of the digitalis in that case will become prolonged. Then what are those specs about digoxin? Narrow therapeutic index. It goes to all excitable tissues, not only heart, AV node, SA node, everywhere excitation is there, means it allows to go and block the sodium potassium ATPase pump. It's a meddler of other issues. So the most common location where it allows to go and block sodium potassium channel is in the GI tracts. There is a meyenteric nervous plexus. That's the reason the most common site outside the heart where the digitalis will act on the neural networks is GI tract, is what you need to remember. Hence, whenever you give digoxin, it is not the arrhythmias of digoxin patient will be worrying. Nausea, vomiting, diarrhea, anorexia, they are all the issues if digoxin is taken. And also it has a stimulating effect on the chemoreceptor trigger zone, due to which nausea occurs. This is another high yield fact, doctor. Don't take it easy. Most common side effect of digoxin, will be thinking, where is the heart, which heart effect? No sir, GIT, nausea, vomiting, anorexia, they are the important side effects which you need to remember, because it is vagomimetic. Diarrhea is the consequence of giving, not constipation. Another high yield elimination factor, right? So commonly asked question. Then disorientation and visual disturbances and altered color perception, they are all the problems with digoxin. And if hypokalemia is there, the digitalis induced arrhythmias become further worsened. How will you remember that? What is the dirty job done by digoxin? It will basically go and block sodium potassium ATPase pump, so that it will prevent potassium from entering into the cell and sodium to go out. That's a natural state, right? So you have given digoxin, it is doing that. On the top of it, if outside the cell, extracellular space, already if potassium is low, will digoxin's job become easy? See, it is preventing, if potassium is there, to enter inside, hence it is showing its effect. On the top of it, if potassium itself is not there, hypokalemia, will digoxin worsen? You didn't get it. See doc, you have seen that sodium potassium ATPase pump, na? Potassium बाहर है, सोडियम अंदर है. बाहर का पोटेशियम अंदर आने के लिए मना है अगर डिगॉक्सिन है तो. Hence sodium can't go out. If sodium doesn't go out, calcium doesn't go out. If calcium doesn't go out, increased inotropic state is happening. Right? So potassium is not permitted to come inside is the main theme why digoxin became so famous. If a patient has got already hypokalemia, that means even if little potassium want to come also, digoxin is not permitting. If that potassium itself is decreased, what will happen to digoxin toxicity? Digoxin's work, it become more easier for digoxin to do its work, and digoxin toxicity can occur. You understood, no? So hypokalemia precipitates digoxin toxicity. But the reverse is a very cruel question of examiner. What is the dysarthritemia if there is already digitalis toxicity? Lot of digitalis is there. Every sodium potassium ATPase in the body got blocked. All potassium is prevented from entering into cell. Everything remained outside the cell, inside the plasma. Hence, what will happen? Hyperkalemia is the toxic effect of digitalis, but the toxicity of the digitalis is promoted by hypokalemia, is what you have to be very careful, doctor. Tasmat Jagrata Jagrata of Shankaracharya while answering the questions in the exam. Because if you lose, if you know, there is no big deal. Even in comatose state, you will answer correctly. But if you have to guess, means don't guess first time. At the time somebody is on their knees to asking you for getting married. That time if you are guessing what he is going to do, is he going to pull my legs? Is he going to throw me off? Why is he kneeling? If you do that in exam hall, is it A, is it B? No. These are all standard questions, standard answers. Now doctor, if you want to treat, first thing is stop digoxin. Second, potassium will help in alleviating the arrhythmias. If hypokalemia is there, please correct that. Then we use antiarrhythmics. Phenytoin and lidocaine can be helpful in management of the digoxin induced arrhythmias. This one favorite MCQ of the examiner. Phenytoin and lidocaine are the drugs of choice to take care of the acute digoxin induced arrhythmias. Then you can do hemoperfusion if there is any acute digoxin toxicity, and anti-digoxin antibodies, Digiban, are also the ones which are used in the management of digoxin toxicity. Now doctor, I will tell you 5 secrets of digoxin which you should not forget. For tachyarrhythmias of digoxin, can you give potassium chloride? Yes sir, because hypokalemia is a predisposing factor. For ventricular arrhythmias of digoxin, give IV lignocaine. For supraventricular arrhythmias induced by the digoxin, because digoxin itself is a drug which is used to control the ventricular rate if there is supraventricular arrhythmia, right? If policeman himself does a murder, what do you want to do? Propranolol. Then if there is any AV block and bradycardia due to digitalis toxicity, due to the high vagomimetic activity. So give atropine is what need to be remembered. Now what antiarrhythmics are prohibited if there is a digitalis toxicity induced arrhythmia? Quinidine, procainamide. Don't give them sir if the arrhythmia is because of the digitalis. Cardioversion and DC shock, never try it sir if the patient is having a digitalis toxicity. This is another favorite MCQ of examiner. Can you give DC shock? Examiner will ask. Innocently, if you give a shock, you are taken for a shock. So DC shock is contraindicated in case of arrhythmias caused by the digitalis. Then for ventricular tachycardias, we use lignocaine, SVT is propranolol, and for the AV block and bradycardia caused by digitalis, we give atropine is what need to be remembered. So what are the drug interactions of digoxin basically? Fundamentally, digoxin is taken orally. That's the reason cholestyramine for his hyperlipidemia or neomycin, anything if you are using it can interfere. Then if the patient is given phenobarbital, it will enhance the hepatic metabolism and lowers the digitalis levels. So quinidine increases the digoxin concentration. Captopril, amidaron, spironolactone, diltiazem, verapamil, they all will decrease the biliary and renal clearance is what need to be remembered. And rifampicin, phenobarbital like P450 inducing drugs, they will induce the digitalis metabolism and decrease the serum levels. Antacids, neomycin, sucralfate, metoclopramide, sulfasalazine are above. List is very long. You remember until you have energy. Not all are needed to be remembered, but at least you should know something will affect the digitalis. That is important. So hypokalemia is one of the important problem which can worsen the digitalis toxicity. And to whom do you give digitalis? Basically CHF patients. So what are the 4 D's you will remember about CHF doctor? D for diuretic, D for digoxin, D for vasodilator. If you don't give, patient will go to 4th D, death, the final solution. So the second D, diuretic, will make the first D, digoxin, to go into toxicity. That you need to be careful, because diuretic lead to hypokalemia. Then calcium channel blocker, if the patient is taking digoxin, what is their interaction? Calcium channel blocker can cause the toxicity if the patient is already taking digoxin. And if there is a hypocalcemia, by the way, why calcium channel blocker will lead to digoxin toxicity? They also act by a similar mechanism of interrupting travel of calcium inside outside. So there is a reason. Hypocalcemia, if it is there, digitalis becomes less effective. Less effective. Then quinidine. Quinidine will displace the digoxin from the tissue binding sites, and hence it will prolong the half-life and decrease the renal elimination of the digoxin, is what you have to remember.